Hello, my name is Cheryl Harris. I'm the Clinical Informatics Nurse Manager, and today we are going to discuss radiology guidelines for appropriate use criteria. This feature has been added to TouchWorks to meet the CMS Centers of Medicare and Medicaid Services requirements for consulting appropriate use criteria for advanced diagnostic imaging services. The radiology guidelines feature provides clinical decision support during the ordering process for imaging procedures. Clinicians are presented with feedback on the imaging orders and procedures that are selected, enabling them to make the best decision for the patient. This will impact our advanced radiology orders, not our x-rays. CT scans, MRIs, nuclear medicine, and PET scans will be those orders that are impacted. This will apply for patients with medical insurance regardless of the type and does not apply to our self-pay patients. Just like you would typically place any order, you will go into your ACI to place these orders. As you're doing your radiology orders, please make sure that you're selecting your diagnosis prior to going into the order. Today's purposes, we're going to select a CT, abdomen, pelvis, with and without, and it's going to take you into an additional screen, which is your radiology guidelines. If you notice, in these radiology guidelines, you're going to see the patient's information here above. Pre-selected order, this is what you've selected within the ACI. It's going to ask you for additional clinical indication. You'll see your appropriateness ranking here. This additional indication is necessary in order for you to get your appropriateness rating. So yes, you do have to do an additional step outside of your diagnosis by drilling down a little bit further to find your clinical indication. For today's training purposes, we're going to use abdominal swelling ascites suspected. If you notice that clinical indication that I've selected here does show here as well, and it gives you the option to deselect it here, or you can deselect it by unchecking it here. Bringing your attention to the appropriateness rankings, if you notice you have several different colors listed here. Your red, of course, is the least appropriate, green being the most appropriate indication, a test for that indication, and yellow, minorly appropriate. With your red appropriateness, you'll notice that the CT scan that you've picked is showing here. You'll also notice that that exam is showing here as well with its appropriateness level, because this is what you selected in the ACI. Now, to go through each one of these appropriateness rankings, if you notice with the red rankings, if you decide to continue with this order, if you hit select exam, it's going to bring you into another screen here that's for the complete order. That is going to give you your requested exam, the reason for the exam, your appropriateness score, and justification. This additional justification is necessary for you to get out of this screen to continue to place this order. So you will notice that there is a red asterisk here listed, and you do have to select one of these options in order for you to continue with the order for your red appropriateness scores. We'll now look at the yellow appropriateness score. If you decide to go with one of these exams for this patient, you will see the same red asterisk for the justification here listed. Of course, it gives you the appropriateness score of 6, but in order for you to continue with this order, you do have to address the red asterisk line by selecting an additional justification. For today's training, we are going to select an appropriate exam. We'll go with the ultrasound abdomen complete. By doing so here, we'll hit select exam. After hitting select exam, it does still bring you into this box, but if you notice, there is no red asterisk here because this is no longer required since it is an appropriate exam for this indication. We'll go ahead and hit accept. Hitting accept is going to bring you into your order as if you would any other order. Of course, if you notice here, the reason that we selected that indication does show in your details under reason. We'll go ahead and select a provider. This should be pre-filled for you, of course. Okay. And as any other order, you would, of course, address any questions that may be here. But I want to bring your attention to our additional details here. If you notice in additional details, it's going to note your guideline score. You'll also see further information, your content source. And then going into charge details, you're going to see this code of G1004. This will show regardless of your requested performing location. This is the charge code for the National Decision Support Company. And if you notice here, there's also a modifier. So these modifiers are further outlined in the education that will accompany this. It just gives you an indication of what each one of these modifiers mean. Now, this information that you have within this order that is related to the AUC guidelines will print out on your order requisition. Excuse me. Your justification will show on your order requisition as well. And the radiology guideline information will be stored within this order. After you've completed all of those things, you can go ahead and save and close. And that completes the ordering process. Of course, after you hit commit, that completes the ordering process for use of radiology guidelines. If you have any questions or concerns, please reach out to your clinical informatics nurse. Thank you.